Good day everyone. I am Richie Arceo. I'm 53 years old and I work as a school administrator / nurse. Today I'll be undergoing eye treatment. I think my eye bags yan. Kasi one day I saw myself in the mirror dahil nasa 50-ish na ako. Sabi ko, wow, ang lalaki na ng eye bags ko. So, yun. Today, I'll be undergoing this eye bag treatment and let's see what will happen. CSA, well, Dr. Contessa is famous noon pa. Matanda ako kay Doktora, but I heard so many good things about her because she's very intelligent. And aside from that, she's my churchmate before. And right now, churchmate ko pa rin siya. So, we belong to the same church. Yun, parang dahil matanda ako sa kanya, parang ate na niya ako. So, kakilala na namin sila ever since na nag-aaral pa lang siya. And she's such a brilliant student. And ngayon, nakikita ko na nagpo-flourish yung business niya. She's everywhere. Nakaka-proud na si Dr. Contessa na kakilala mo lang noon. Ngayon ay she's going to different places, speaking and, mentoring about medical aesthetics. So, ayun. Doon ko po siya nakilala. And don't forget to subscribe and click Contessa Salvador's YouTube.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's all welcome Ma'am Richie Pusong Arceo.
Morning.
Good morning. Hello. Yes, okay. Today, the concern actually is the under eye area. Okay, a lot of us could relate to this problem of this eye bags, dark circles, hollowness under eye, wrinkles around the eyes. Okay. And then some people are wondering, oh, what caused this? How did I get this? How did this develop over time? Yan. Ma'am Richie, you mentioned something about genetics.
Yeah.
Right? So meaning to say it runs in the family or you can inherit it from your parents.
Most of my dad actually, malaki yung eyebag niya. So, when I saw myself one time in the mirror, I saw, oh my God, dati na akong eyebag.
Yeah.
Meron na akong eyebag. So,
starting to manifest. Like, when did you start to notice it? What age?
I think yung just recently. Yeah. I'm doing my makeup and then I suddenly saw myself on my ito na aging. I saw my eye bags are so big and then may mga wrinkle on this part.
Right. Yeah.
Sabi ko, ito na to.
Yeah.
Ito na to. Di na mapipigilan.
Yeah, there's the puffiness thing and then the bulging thing and then you'll notice some lines being obvious already. And, okay, aging is also a factor.
Yeah.
That includes the aging aspect there. Okay, over time, the skin becomes loose. Your collagen, elastin, those structural tissue matrix, they're decreasing. They're getting depleted over time. Plus, some of the ligaments in the under eye area that holds or support your soft tissues, they also weaken over time. Plus, the muscles around the eye, we call it orbicularis oculi, it also weaken over time. And there's this septum that separates your soft tissues in between. It also weakens over time. Everything weakens over time. So, it's the aging process, the letter D's of aging. We have 3 letter D's. The skin deterioration, or degeneration, the so-called depletion of some of the soft tissues, and the so-called descent. Descent, yun na. Full of gravity, it goes down.
Yeah.
So you're noticing nagsasag na yung under eye area. So the aging aspect, okay? At our age, 50s.
Yeah, I know.
50-ish. We start to notice those aging signs already. So, and of course, the genetic aspect, it contributes to it, okay? Actually, there are other types. I also see young people getting under eye concerns. Even young ones get eye bags. Okay, their lifestyle. The young ones right now, how many hours do they sleep?
Yeah, actually.
Because of the online thing, they stay late. Overnight, I think they're playing video games.
Yes, that causes their eye bags.
So the lack of sleep, unhealthy lifestyle, and there are other factors contributing to it. Actually, we have different kinds of under eye problems. We label them, meron tinatawag na W type, P type, V type, S type, mixed type.
Wow.
Ang dami na, no? So actually, the W type, din yung wrinkle type, where you start to see the wrinkling of the skin. Then letter P is the pigmentation type. So the others naman have like dark circles, pigmentation under eye, something to do like genetics also. Like Indian races, they have like discoloration under the eye. The other one, the vascular type, it's vascular. Yung mga blood vessels. So some of the palpebral vessels under eye, they're so obvious, they're dominant, or they have thin skin that you see some of the veins. I see some of my patients, you can visualize their veins here. Okay. There's also the structural type. Diyan tayo pumapasok. The structural type, the eye bags, okay, the puffiness under eye, some structural deformity already, or like we call teardrop deformity. The anatomy itself, the structure itself, could be like a genetic factor, okay, yung structure. Meron yung medical type. Medical type will be those who have history of allergies, allergic rhinitis, bronchial asthma, allergic dermatitis. You notice they also have skin problems under the eye. They also itch around the eye. They tend to always rub the eye area. So the friction, the rubbing causes this discoloration, some of the poor skin texture. So yon, may mga history ng mga allergies, tapos parang nangingitim or something yung under eye. The others naman, malnutrition, iron deficiency, or dehydration, na dehydrate. So we in the medical field, when we check on dehydration, lubog yung under eye. Tapos the others have medications or other medical conditions, other diseases. Meron silang tinitake ng mga supplements or maintenance. Yan. May mga maintenance medicine sila, may mga medical conditions or liver diseases. Yun yung medical. And then we also have the so-called mixed type. Yun na yung M type, yung mix ng may allergy, na mix ng may structural. Ako may ganun ako I have allergies tsaka structural. So mixed type. So those are our classifications when it comes to under eye problems. Ang dami pala nun. So that's how we also diagnose conditions around the eye area. Yun, usapang mga causes pa lang yan, Ma'am Richie.
Wow.
Wala pa yung usapang mga ibang factors. And also, how do we treat it, and what are the other factors that we look into, okay? So, we'll continue. We'll learn more when CSA Medical Aesthetics returns. And we're back. So, we're discussing, Ma'am Richie, on the eye area. And a while ago, actually, we just mentioned also one of the causes in terms of the diet, right? Like when you eat salty food. So, the next day, you'll have this kind of puffiness. So, the water retention thing. So, diet din pala. Factor din, actually. So, to add to those discussions, okay, when we're working in the eye region, okay, this eye area, of course, as doctors, as injectors, we have to be knowledgeable about the anatomy, okay? So, the tissues around the eye area, so we have basic 5 anatomical tissue layers from the skin, Then we have the superficial fat layer, and then beneath that fibromuscular layer, a deep fat, and then the bone layer. Okay, so when we work on those tissue layers, we have this concept of targeting a certain tissue to kind of restore its original strength, its original anatomical condition. This restoring what we used to have when we were younger. Okay, and of course, as injectors, we know also the blood supply to those tissue layers, yung mga arteries and veins. So we should know where the blood vessels are. Like for example, when we're working below the eye, we avoid the so-called infraorbital foramen here because you have your blood vessels there and nerve. And also here, supraorbital, we avoid also the supraorbital blood vessels and nerve and supratrochlear. So there are safe areas where we can do injections, and we can also make use of our energy-based devices. What I will start with is the so-called ultherapy in the under eye area. So I have a device, it's US FDA approved for skin tightening around the eye, for lifting this saggy upper eyelid, and also strengthening this lower eyelid section. So we'll also start with our ulthera. And then after the ulthera, since it will target skin and also some of the subcutaneous fat layer there, I'll be incorporating with my UltraCol, our powder PDO filler, that will also regenerate your dermis in your skin tissue. And I noticed, Ma'am Richie, this one, hollowness of the temple will restore also volume in this area. Okay, so it's a combination treatment, periorbital rejuvenation. I'll start with my ultherapy first, okay? So this is our ulthera device, and I'll use the transducer 1.5. So no needle here, just close eyes. And then we will be working on the skin under the eye. So first shot there. How is that, Ma'am Rich? Okay lang. Okay, so I'll work on the right side under eye, infraorbital section, and we'll finish off to the opposite side. Okay, so that's for the ulthera. So our goal is to also stimulate collagen formation in the dermis layer, stimulate those fibroblast cells to regenerate, to synthesize new collagen and elastin and hyaluronic substances in the dermis layer, and at the same time, like, target also the orbital fat, the one that also bulges. So we want to also reduce that, flatten that. Okay, so the next thing that I'm gonna be doing is making use of the so-called UltraCol PDO powder filler. Okay, so that's the world's first polydioxanone type of filler. Okay, so instead of using hyaluronic filler, we'll be using the PDO powder filler. It's also called as liquid threads. Okay, so in the past, you've seen our other videos, we were using PDO threads, the strands of threads in the under eye section. Right now we have this PDO powder filler. Actually, this type, they contain like around 1,427 threads in a single treatment. Okay, so instead of using those strands of threads, we'll be using right now those microspheres of our polydioxanone. Okay, so for my treatment, I'll be using cannula here. So I have a 1 ml of my UltraCol diluted in our diluent. Okay, so an entry point here, pain freeze please. So we'll use this pain freeze so that there's no discomfort from the needle prick. So a tiny prick there, just a tiny prick, Ma'am Richie. Sorry po. Okay, there you go. And I'm using a cannula here. Okay, you can use like a gauge 25 to gauge 22 or 23 cannula. Okay, so I'll just deliver this in that teardrop section there, teardrop. Okay, and just a minute amount, delivering it in a gentle way. Okay, I'll be using 0.5 here per side. So this is to regenerate the skin tissue, stimulate your collagen, and at the same time help with the repair of tissues. And this also has a so-called brightening effect for those with concerns of dark circles. And so this is a powerful collagen stimulator. So it's one of those collagen stimulating product that we use right now. Okay. So other collagen stimulators that we use, you've heard of the Sculptra, you've heard of the Radis. So UltraCol is also for collagen biostimulation. Okay, so it's not hyaluronic, it's a polydioxanone in microspheres or microparticles delivered in our skin dermis and subdermis. So the anatomical layer where you can infuse this product, you can infuse it in your dermis to subdermis layer, where you have your fibroblast cells to synthesize your new tissue protein matrix. Okay, so let's go to the opposite side. There you go. Paint freeze, please. So this is a paint freeze spray, so that there will be like instant numbing of the skin. Although a while ago we already applied numbing cream, topical lidocaine to numb the skin. So we're just delivering it in the tear trap first towards the medial canthus there. It's important to deliver the material in a homogeneous fashion. Make sure that it's equally distributed in the right tissue layer where you want to deliver the product. Okay, so it's like a half ml per side, half mil, and just a fanning technique, fanning method. And I want to also deliver it in the lateral canthus. I just have 0.2 in my solution. Then I'll do a combination procedure for Ma'am Richie. I'll be doing the so-called periorbital treatment or periorbital rejuvenation. I notice she has sunken temple, so we'll restore the volume in the temple region. To improve also infraorbital concerns, you also assess their temple area. The temporal region, if you notice there's volume loss, it's gonna help when you restore the volume there with your hyaluronic filler. So this one is our UltraCol for skin regeneration, repair, and also collagen biostimulation. So I'm just delivering some of our products, some more. Okay, almost about to end there. So distributing it in an equal fashion. Okay, for my final approach, I'll be doing the restoration of volume in our temple area. Paint freeze, please. So again, for temple, I use my needle technique, needle method here. So 1 cm lateral to your temple fusion line and 1 cm superior to your lateral orbital rim and onto the bone. So I'm using a high G prime type of a hyaluronic filler. It has a rheological property with viscosity, elasticity, and it will give that instant projection. So it's gonna lift also the inferior aspect, the ones below this treatment area that we're doing. Okay, just pushing the product material here. This is a simple method for temple volume restoration. Just half mil of this. Some cases I use 1 mil. Okay, so we're starting with just half mil. Then this is a hyaluronic again. Hyaluronic is a natural substance. You find it in our skin tissues, in our connective tissues. So it's safe and it's been used for a long time already. So we just wanted to restore volume in this part of our face. To kind of also lift the corner of the eye, the corner of the eyebrow. So we'll do some aspiration first. And then after that, we're going to infuse the material. Okay? So it's important that when you do your periorbital rejuvenation, you assess the temple. You can also assess the forehead region, apart from assessing the under eye area. Actually, right now, I also include the center of the face, the nose region. There are cases we do nose thread lifting as part of our periorbital rejuvenation. You're still okay, Ma'am Rich? Okay. Tita Rich. Okay. I call her Tita Rich, rich in love. Okay, there you go. So this is just a quick technique. So we're delivering it in that so-called super periosteal plane. So slow push only. So our goal is to restore volume here and also lift parts of the face, especially mid-face section. Okay, so this is also called liquid lift. So we did combination procedures today for Ma'am Rich. So using ulthera, using our ultracol, and as well as our hyaluronic dermal filler for our periorbital rejuvenation. We'll show the result when CSA Medical Aesthetics returns. And we're back, so let's show the result to Ma'am Rich. This is the mirror. Ma'am Rich, look at that.
Wow!
So we did the combination procedure, the ulthera, the ultracol, and hyaluronic filler for the temple. So I'm seeing actually an improvement right now, although this is not yet the final outcome because we have the ultracol polydioxinone microspheres inside the dermis subdermis layer. It will still work. It will stimulate fibroblasts. So usually 4th week, you're starting to see some collagen formation already. 8th week to 12th week, that's the span of time that the product is still working inside. So gradually, it will still improve the skin texture, the skin quality, the skin integrity. Also, the ulthera, it stimulated your fibroblast cells. Same thing, it will still work within the first 12 weeks.
Wow.
And then we have a hyaluronic filler in the temple. It will attract water, more volume will still happen, and it will still improve, and it will still plump up. Any comment, Ma'am Rich?
Masaya ako. may nakita na ako dito. Grabe.
Improvement, yes.
Oh,
Kasi a while ago, this part here, the tear trough is sunken.
Yeah.
Lubog siya. So we were able to fill in with our ultracol powder filler. So the sunken area, beneath it, you inject your product and it's gonna push the skin upward. So treating that hollowness there, that sunken part there. And the job of this material, this product, will not end there. It will still work as time passes by. So inside, molecularly, there will still be some improvements there, some changes there, tissue structure development there. So it's like happening during the first 3 months. Okay. Actually, I will still do an additional treatment for Ma'am Rich to treat the so-called wrinkle type. So we'll also be injecting a botulinum toxin, a low dose of it, to relax the muscle, because the muscle here, the one that also bulges the muscle, we want to also relax it so that it doesn't become like a bulging. We call it eye roll, okay? And plus, to treat the wrinkle of the skin, okay? So itong part na to, we'll still treat with the micro Botox there. So I mentioned in the past that we were doing like pinching tests on the skin. If you notice that the skin stays like wrinkled there, meaning to say you really need to restore that volume, the collagen, the elastin, and your glycosaminoglycans in your skin tissue matrix. Thank you, Ma'am Rich.
Ako magpapa-thank you, Doktora. Oh my gosh. Bumalik na ang aking pagkabata.
So that's a preliminary effect.
Wow.
So you'll see more effects of this one as days pass by, weeks, and even months. So this is a non-surgical approach, okay? So it's a safe kind of a procedure, and you see an instant result already. Plus, it's still you. Natural beauty is what we want to achieve. Because a lot of us, we don't want to look like we've had this, what do you call that, altered anatomy and looking like a frozen face or altered, what do you call that? Like, others are saying Joker's face, frozen face, or yung wala ng facial expression, hindi na natural, or parang plastic na, something like that. So we want procedures right now that you're doing something but people are noticing, bakit parang fresh ka or blooming ka? That's the goal of aesthetic medicine nowadays. And still you.
Yes.
There you go. So, you want to say something, the audience?
Doktora, I would like to thank you for this privilege to be your model.
Yes.
Salamat po. And then, I thought it's gonna be masakit. Hindi. Hindi po.
Yeah,
Hindi po.
actually.
Magpagawa na kayo. I'm so happy kasi sabi ko, I keep on looking myself. Ito, meron na ngang changes.
Improvement, yes.
Instant, no? Although, sabi mo nga, as the days goes by, mag-iiba pa to.
Yes.
So, I wanna see
Yes.
the end result of this. And it's not painful, I tell you.
Yeah.
Para ka lang parang mga maliliit na
Tiny
kurot lang.
pricks,
Yes.
yes.
Very very friendly
Right.
yung procedure po. So,
Yes.
huwag kayong matakot. Just visit CSA for this
Okay.
eye treatment procedure na talaga namang, the natural look, yun talaga
Exactly.
ang gusto nating ma-achieve. Ayaw natin yung parang hindi na ikaw, no? Parang
Correct.
hindi halata, pero yun nga, yung parang ma-restore yung dati mong itsura.
Exactly.
Salamat po.
So in our center, we have the Ultra Col PDO powder filler already. So this is an alternative for those who don't want to have the PDO threads or those who don't want to have the hyaluronic dermal filler. So PDO powder in microspheres, it's safe, and we just deliver it in the right anatomical layer. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Marugul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos in our YouTube channel, Contessa Salvador, and please do subscribe and click the like button as well. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.